Hello, everyone. My name is Jason Long. I'm the General Manager for Net Solutions at Cantata Health, and I'm here today with Kevin McCormick, and we're going to be talking today about how some facilities have gotten $100,000 and up from the HHS and how you can get that money as well. So, Kevin, it's good to see you again.
Good to see you. Good afternoon. Yeah, well, I'm figured we'd talk about the provider relief funding for COVID-19. This is phase 3, came out on October 1st. It's run by the Department of Health and Human Services, and they've got $20 billion more dollars. And if you haven't put in for this as a nursing facility, a skilled nursing or an assisted living, you really need to get on the ball and have that done. And the reason is this money is available. You can start applying for funds back on October 5th. It's the 22nd today. So there's a time frame. And the last you can apply for that is November 6th, 2020, which is a Friday at 11:59 p.m. So you've got a bit of time, but don't want to be the last one. You don't want the funds to run out. Seems like 20 billion, that's a lot, but there's a lot of money going out and there's a lot of different providers. So who's available? Who gets the money?
Well, before you go into that, I have a quick question. What can you use the money for?
You can use the money for virtually, to run your facility. And what they're trying to do, Health and Human Services, stated that the general distribution is designed to balance an equitable payment of 2% of annual revenue from patient care for all applicants, plus an add-on payment to account for revenue losses and expenses attributable to COVID-19. That's a lot of money. And it's something you might work with your accounting firm with, or if you have someone sharp in-house to do that, but it's a lot of money for every nursing facility. You don't want to leave it on the table because you'll be struggling next year. There's been, you've got, the COVID-19 expense, you've got reduced occupancy rates. So it's tough. It's been a tough time for the nursing facilities, and this is certainly a helpful piece.
Sounds good. So you were talking before about who's eligible. I take it it's not just nursing. There's other people who are dipping in this fund as well.
There is. It's been expanded to include a group of behavioral health providers. It's also for acute care hospitals, dental services. A local hospital near me got $128 million. It's an incredible amount of money, but that's it. And one of the things that does happen when you do get this money, it is public. People can go, if they have any, no one's going to know to do this, but you can go to CMS, and in some little corner over there, you can download an Excel spreadsheet to see everybody in the country that has gotten this. But it's all the eyeglass providers, optometrists, all different types of offices, of course, physicians, and so everybody's in it, but they do want to make sure that nursing homes and assisted livings get their money.
Gotcha. And is this a loan or is this a grant?
It's neither. Well, it's I guess you'd say a grant. It does not have to be repaid.
Gotcha.
But that's assuming the providers comply with the terms and conditions of taking the money. So once you apply for it and you get it, you do have it'll be 90 days that you can say, you know what, I don't want this. And you can send it back. But if you don't do
that.
Excuse me?
I said, who is going to take their $100,000 and send it back?
I'm not sure who would, but
yeah.
It is there. There's always, there's a clause to get out of it. Maybe, you didn't figure out the amounts right and you don't want to take it and get penalized. That would be the only thing I could think of.
Gotcha. And so who's eligible for it? And how do you determine eligibility?
Well, I'm just going to focus on assisted living and skilled nursing, since that's what we're more focused on. To So any state's licensed or certified assisted living facility as of March 31st to 2020 is eligible to get this money. Now, it is important to note in regard when you're talking about the assisted living that if you're going to get these funds, it's to pay costs associated with CDC compliance. So ALFs, they generally have a large portion of their revenue, which is attributable to the residential portion of their business, i.e. like the rent. So independent living, so if it's a CCRC, that part doesn't count, but it's the part that where you're giving nursing services, you're giving out the meds, you have CNAs, you've got a memory care unit that's an assisted living. That is, you can break out that patient revenue and get that 2%, plus the extra for the COVID-19 expense.
So if you're pulling out the patient revenue, I believe that Net Solutions will do that for you, right?
It does. Now, one of the nice things, features that we have in Net Solutions GL, I can print out a income statement and I can just ask for revenues, and I could break out the revenues any way I want to. So I can say from this general ledger number to that general ledger number and pull it out. So you can get this information very quickly, which is really nice. And so if you're using the Net Solutions, it's a great tool. If you're not and you're having a lot of trouble, certainly give us a call. We could certainly help you out with that, because this may come up next year as well.
Yeah, great, fantastic. And then I think you said a little bit about the timing. What can you remind me? What is the deadline for this round?
The deadline is November 6th, Friday at 11:59 p.m.
Okay, and so next Friday.
And what you need to do is go to the Health and Human Services Provider Relief Fund application and attestation portal. That's always a tough word. So you have to file it to be considered for the funding, and I'm sure we can put that out on the in writing on the website there, so that will be available to you if you're not able to find it. So once you pull that up in that portal, the first thing that there's 6 steps. You determine eligibility. So if you're a nursing facility or an assisted living, you can go ahead and put that in there. You have to validate your tax ID number. Then you go and apply for the funds. And once you're in the portal, and I haven't been in to see all the detail because I don't have a valid tax ID number to do that. But the applying for the funding is, essentially, all your service revenue. You put it in, and they sort of guide you through it. Again, make sure that the person doing it does know what they're doing. You don't ever want to have to pay that back. You want to be careful, but you do want to get everything that you possibly can. So definitely have someone review it if you could. Then you receive your payment, and you also attest to the payment. Because like I said, you can reject the payment if it's within 90 days for whatever reason you don't want it. But if it's 100,000 or more, you're going to want that money.
Yeah. Or if it's any money, you're probably going to want that money.
That's true. There's one thing about that money. It is considered income by the IRS, which of course
is taxable.
Taxable, which makes sense.
Yeah, that does.
So no one ever gets free money without some sort of hook on it. So there is some tax, but the way the industry's run, I'm sure that the amount of tax is not going to be all that much.
Yeah. Okay, perfect. So anybody who's watching this, jump on it. You've got just a couple weeks. Let's see, it's the 22nd. Right now is the 22nd of October as we're recording this. You've got until the 6th. So get out there and grab the link in the website and make sure you can fill it out, get your free money, because we know that you need it.
There is one other thing I want to mention.
Okay.
There is another portal, which is for providers to seek reimbursement for COVID-19 testing and treatment of uninsured individuals on or after February 4th of this year.
Okay.
So as part of the Families First Coronavirus Response Act and the Paycheck Protection Program and the Healthcare Enhancement Act and the Coronavirus Aid Relief and Economic Security, the CARES Act, HHS will provide claims reimbursement for healthcare providers generally at the Medicare rates for testing uninsured individuals. So if you have to test your people, you will get reimbursed for that, and which is key. And you'll get reimbursed at a high level of reimbursement with Medicare. So you get at Medicare rates. So another link that I'll put on there is the COVID uninsured claim. So if a person comes in, they don't have health insurance, you don't have to eat that. You can go in here and put it in and you'll get reimbursed at a nice rate too. So at the bottom, we'll certainly put that in on below this video so you have that information as well.
Gotcha. So and I think I see the link right here. You got coviduninsuredclaim.linkhealth.com. Is that correct?
That is correct.
All right, perfect. And I wanted to clarify one thing. On the eligibility, you said it was assisted living facilities, nursing homes, so skilled nursing, acute care hospitals, behavioral health providers, and then just kind of everybody else. Is that close? Is that right? Is there anything else? Any other specific ones that you wanted to bring up?
No, I think there's behavioral health was added in there. We got dental, ophthalmo, I kind of won't even say it, PI people. You've got all your physicians. You've got, different physicians group. So everybody that's been affected by the COVID-19 during the course of the year where they weren't able to open their office. So a lot of people, virtually everyone was affected in healthcare.
But especially long-term care and skilled nursing and such.
Absolutely. Okay. They've been probably affected the most.
Yeah, I'm sure they were affected the most. All right, perfect. This is super helpful. As always, we're going to get this out to as many people as possible to help everybody collect some money, make sure that everybody is thriving during a difficult time. And as always, thank you so much, Kevin. You're so very helpful. And I appreciate this, and everyone out there really appreciates it.
All right. Have a great day.
You too. I'll talk to you soon.
All right. Bye.
Bye.